My name is Tembi Aris. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment. The health industry or health has got two dimensions: the alternative dimension and the medical dimension. But unfortunately, these two dimensions don't talk and they don't collaborate, to the detriment of the recipients, that is the patients out there. I am the epitome of these two dimensions.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to our show. This is the month of April, a month where we are creating more awareness about autism. So during this whole month, we're going to be covering this topic to try and bring more information, to try and ease the pressure and frustrations that parents go through in taking care of their children. We have our guest here, who you know by now, and we're going to be navigating this show of today with him. Welcome to our show.
Most definitely, yes. Welcome. Good day to the wonderful viewers. I go by the name of Lukolo Nondwana, and definitely will be unpacking more about autism. Funny thing is about this topic that we're talking about is that I was actually one of the victims or was affected with this as a very young child. And I must say, judging from the experience that I got, it's definitely not nice, man, because I remember growing up, I couldn't even talk properly. I would even be scared to communicate with a lot of people. And you can imagine you at school, you know, you are surrounded by actually people. You need to communicate at school with the teacher, with the learners. So I definitely found it hard. So it's going to be really interesting unpacking some type of stuff that I would probably even learn that probably it was the causes. So I'm looking forward for this topic.
Yeah. Well, it's actually, like you say, it's interesting that you have experienced this. But now, just for me to understand, were you ever diagnosed as being autistic? Or it's just these symptoms that you experienced that made you think that you are?
Well, I definitely just think it's probably the symptoms, because I'm saying this because I don't think even my family at that time really took it really seriously. I think it took time for them to realize that I think it's probably getting really serious. Because I remember they just thought it's probably just growth, it's just probably growing up. You know, he's going to get better by the day goes. But I think they really took it probably seriously when I think one of my teachers back then reported the situation because I started lacking at school because I didn't want to speak anymore, you know. And you know, kids, us growing up, we'd tease each other, we'd laugh each other, but sometimes that thing, as children also, you take it personally.
Yeah,
you know,
sure.
So that really affected me, affected my self-esteem. So I just definitely think it was just the symptoms, man. You know,
I'm actually thinking of Steve Harvey. You know Steve Harvey, the comedian. He was a stutterer when he grew up, and he said he was struggling with his status, and he said he came from the poor end of the Americans.
The Americans, yeah.
You know, and he said there was this teacher who this particular day, who used to make fun of him, and she she never really took him seriously, and so he didn't really care much about his performance, and because he was expected to not do good anyway.
Yeah.
And he said this particular day they asked what would they want to be, in their career choices. And they all gave this, and then he said, I want to be on TV. He said, I want to be on TV. And the teacher said, is there anyone in your family who's ever appeared on TV? Oh, he said that finished him, because for it to come, he said, you can handle it when it is the child that's teasing you, when it's your peer, but when it's your teacher, because that's the person that you expect to speak on your favor, in your defense.
True.
So, and she said, that thing stuck with him for a long time. But now he was saying, Miss, do you see me now? Because he's now an icon, in the field. He's a celebrity and all that. He said, I wish I could see Miss So-and-so. He never mentioned the name though. He said, I wish I could see that teacher today so that she can see that even though I was so disadvantaged, not only because of my background, poor background, but also because of my shortcomings, communication and even understanding things, but that never stopped him. So he was actually motivating youngsters that you must never be blocked from achieving, realizing your dream just because you have certain disadvantages or shortcomings.
Yeah, that's true.
Yeah, so in a way, there's lots of people that, lots of kids that end up even dropping out of school because they cannot handle the pressure, because peer pressure is ugly. Peer pressure is ugly. But at least in the past years, during our time, there was no bullying. The peer pressure was there, but it was not as bad as it is today. Because I think today, because the teachers are not even allowed to punish the children, give corporal punishment, so they can only either do detention. I mean, the kind of punishment that is meted out these days,
they're so lenient.
Is silly. It's actually silly. That's why, kids of today, you find they just get away with murder, But then it is stifling a lot of children from realizing their dreams because they just cannot handle it.
True.
But anyway, coming back to autism, maybe your symptoms. What were your symptoms? Other than, was it just the stuttering?
I think what I remember, it was definitely the stuttering was one, and the breathing.
Okay.
Because every time I would
battle to breathe.
Yeah, but nothing is really coming out.
Yeah.
So it was tough. It was tough. I feel like too, I was one of the people that were like bullied, emotionally, because there were times that I didn't even want to go to school.
Yeah.
I would sometimes make an excuse that, hey, I'm sick, I've got a runny tummy, knowing that I'm very well. It's just that I don't want to be there, because everything starts from the transport that I used to take. Kids just couldn't wait for me to just get in there. They'll be entertained. It would be laughing there, be people like mimicking me. People want to spark like conversation because they know how I'm going to respond. So it was definitely tough, but definitely it was stuttering and breathing.
So how did you deal with this? How did you outgrow it? Because look how well you're speaking now. I mean, nobody would ever even think that you had problems.
I would be lying if I could remember like correctly, but I just remember my mom taking me to, I think, a doctor or something, I just don't remember quite well what I received, but I think that also kind of helped me. But I think also growth also being strong and telling yourself, like the Steve Harvey thing, you know, just telling yourself, gathering yourself and telling, hey, you're gonna do this. So I started being that guy, you know, and the confidence kind of built, you know, but it took a while. Took a lot of courage. It really took a lot of courage, but hey, by God's grace, I'm here now.
Here you are. Here you are.
Yeah.
Maybe those that were saying, look, maybe they're the ones that now, if you walk, you might actually bump on them in the streets, being
exactly,
you know.
Yeah. But definitely, one of the things that I really want to know is what causes actually autism.
Yeah.
Because I still don't know even now, because I'm one of the victims, as I said, but I still don't understand it. What causes it? Because you are not born with it, right?
Well, you are in some cases, but actually, maybe we might have to break down even the definition of autism. Yeah, because in the previous show we did touch on what it is, and maybe we can take that further as to what causes this. You see, with me, Lukolo, the difference with me is that I take the definition, autism as definition, to just be a ballpark phrase that has been coiled to explain certain set of conditions or symptoms. Because if you look at autistic children, you already know that they will fall in this list. They may not tick all the boxes.
True.
But you know that there will be some ticks on these boxes.
True.
Like, for instance, some are non-verbal, they cannot speak at all. Some, they don't even understand. Even if you speak to them, they're just nowhere. Most are very emotional. They've got anger issues, you know, emotional outbursts. And interestingly, did you ever have such issues?
I think I kind of had some anger issues. You know, I would just out of the
snap,
blue, you know, snap. Like even a little thing would just irritate me.
Yeah,
I'll be going out from the house, banging doors, even at school. You know, at school I was the worst. Like most of the teachers would probably say that I was being disrespectful, but it really made me realize, hence you are saying it now, that it was probably one of the reasons, because I had anger that me myself couldn't sometimes understand where it came from.
Yes.
You know, so
yes.
Interesting.
Yeah. So that ballpark phrase, therefore, has from the researchers that worked with it, I mean, that were doing all the studying and whatnot, they've managed to stream it down, or to bring it down to a list of symptoms that they have found consistently to manifest in children that are labeled as, like, for instance, I'm mentioning that some cannot talk, some can, but maybe talk, but there's still issues with their speech. That's why you find in their program there will be speech therapists. Some don't understand at all, even the instruction, you know. So there is some kind of a discord in input and output of information. Some, like emotions, like I'm saying, some understand but cannot talk. You know, like in your case, they start, others stutter, but some don't stutter at all. They're just totally nonverbal. But somehow they seem to be able to understand. Whereas others can't talk and can't understand. You see the difference? So there's a whole list. Some have got issues, digestion issues. Some are epileptic. So there's a whole list that is grouped under that. And once you go to a psychologist, they see tick, 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 tick. Then you get the labeling. You are autistic. Yeah. Then there has to be so many that they tick. If, for instance, there are 15, at least there must be 10. I'm making an example. If you tick 10, even if 5 does not apply to you, but if there's 10, then you get the label. Then you are autistic. So that's how they've put together this study and coiled this this phrase. But so that's how they've put this together. But now when it comes to me, I'm doing it the other way around. The other way around. In what way? That I will scan you and I will tell what kind of symptoms you should manifest. Whereas with them, they look at your symptoms, they tick, 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 and then they say, you are autistic.
Yeah.
But with me, I don't say you're autistic. You come with a diagnosis of autism, but I scan and I say, okay, with what I'm picking up, now I'm going to come to your condition because I already see where it fits. Now, in your condition, the fact that you were stuttering, okay, because you do get children that are autistic that will stutter, okay, and also the breathing. Now, what is coming to me is something that is called a vocal cord malacia, okay. You see the vocal cords have got a tissue that flips open. Like when you talk,
as you're speaking,
it allows for the breathing even when you sing. It allows for the air to come in. So it's that tissue. So when that tissue is floppy, it's not it has lost its elasticity, be it genetic or because of other medical conditions. But when you've got malacia, that tissue, there are problems with that tissue. So the way it flips, and then you find, that's why, for instance, even with the breathing, you would find the breathing, because it blocks the vocal cords, everything is in that same location. So when it flips open, it flips, it blocks, then you find there's no flow of words, because the words must flow because the space is there. But when you've got that, then it's closing and doing its own thing instead of opening and closing. But yours is, so then the word is not coming it's not flowing. Yeah. So that's malacia. So children that are autistic, some of them, if I may use this term, some of them have got that. They will stutter. Okay. But then what you find with people that have got malacia, like for instance, children that I have found who end up sitting with malacia are children that have got congenital disorder of glycosylation, and also children that are fructose intolerant. Okay, I will explain why, particularly those that you find are fructose intolerant, because people that, or even children that are fructose intolerant, when it is aldolase A, because remember, fructose intolerance affects the tissues, affects the liver, and affects the brain. Okay, so when you are deficient then on that enzyme, and then you find it's hitting more on the tissues, so that tissue in the vocal cord that you find is flappy, instead of it's doing its own closing, it's doing its own thing. It's a loose cannon instead of following what it should and closing when it should. So then you find that tissue, just like any other tissue, gets affected. So it is one of the things that I have found on those kids that I've discovered to having malacia. Vocal cord malacia. So that's one of the things. So by fixing because that's what I've done in some of those cases, where you find, firstly, I take them off fruit because they are intolerant. So the parent know they must not give fructose, anything that's got fruit at all. And then I restore the elasticity of those tissues, the connective tissue, strengthen the framework of that tissue. Then you find the voice, the tissue is no longer flappy, it's now k, k. Then you find the child ends up talking, so there's no stuttering. So that is why you find that some of cases like that are easier to outgrow it than when other causes are in place, which I will make reference to. So that's one. Number two, when it's congenital disorder of glycosylation, because remember that one, the problem is the synthesis of proteins with sugar and lipids. Okay, because remember we get these foods separately. Your proteins, you get your proteins, you get your fats, you get your sugar, but for the body to use them, they must synthesize them. Okay, so there's the chemical process that actually occurs which regulate the progression of the processing. So when you've got CDG, therefore, like I mentioned in the past, it's when some of these processes, because remember these processes, it doesn't mean it's one full process at this. It's one small process, moves to the second one, moves to the third one. It's a chain. So when in the process, or in this chain, there are certain areas where that synthesis is not occurring, then you find you get stuck. Even with this malacia, that when it is the glycosylation disorder, and then you find you cannot proceed, it's you cannot proceed because that step is faulty, is fictitious, up until something fixes it. Okay, how do I fix children that are disorder of glycosylation? We create fictitious steps, that these steps, because you're supposed to climb up the step, so those steps that are fictitious, then we're creating a prefab step, makeshift kind of step, so that the progression occurs, is not blocked because it gets stuck in that particular area. So then the medication creates that fictitious step, then you find you can proceed. The chemical processing actually moves to the next step. Then it gets to another one again. Then we up until with those fictitious steps, we have opened the path for the progression, for the chemical processing to occur unhindered. Then you find instead of the flow occurs, then you find it occurs. So that's one. But now with people that are not suffering from malacia, like in your case, where it's occurring somewhere, like others will have seizures. When it hits that, then you find they're having seizures. And it's like, what caused the seizures out of the blue? Because you're hitting that step. Others cannot breathe, What is causing the obstruction? It's because of that glycosylation disorder. So once we close all those gaps, then you find the flow occurs. Then you find, he's no longer having seizures. He's no longer stuttering. He's no longer having breathing issues and all that. So, but you've got to know why in this particular case it is occurring. Because even these two examples that I'm giving you, where it's fructose intolerance, aldosterone deficiency, then I can see, in this case, it's because of this. But this is how it has affected. These are the tissues that are affected. So this is what is happening. And then you find, I will say to the parent, this is what, and then then she relates to that, okay? And when it is occurring in the brain, then I say, this child is having epilepsy. Some parents, you find, they don't even realize the child is epileptic. I had one parent, I've given some various examples. I had one parent who did not even realize that her child was epileptic. So I treated the child, and the child, remarkably became so, progressive, recovered so very well. Now she sent me I'm not sure if I touched on this particular case, but now she sent me a report, okay, where her child, she returned the child to school, but the first day the child went to that school, he was just nowhere. He was restless, panicky, and the teacher gave a very gloomy picture of how the child was reacting and how he was, moving up and down and all that. But remember, this child is not on Ritalin, because most of them, they will say ADHD. That's also one of the things that you find. They say ADHD, or it's just others is they're not hyperactive, but they just cannot concentrate. You talk, they're nowhere. Okay. So those are also the list of symptoms. Let's go for a break, and when we come back, we will talk more about this.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to ADALase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are talking about autism, as this is the month of autism awareness. We're trying to give you some answers and make the picture a bit clearer. Okay, so when we went for a break, I was touching on some of the cases that I'm treating, and there is something that parents don't know it happens, and that their children get seizures. This one happened in Joburg, and this parent brought the child, autistic. This particular one I had treated. Actually, the grandparent, they are foreigners. The grandfather is a doctor. So he was referred to me by this an old client of mine, and I got that child to talk. He could not talk, so I got him to talk, and then but he just took the one batch of medicine and stayed for the whole year, the full year. So in my previous visits, he booked the child. Now, when I was, and he was the last, it was the last client before we finished for that day. So the child is not one of those that are restless, he was quite calm, and in terms of sitting still as is required. But I could see that I could hear, because I was on the other room, and I could see through the glass that the father was trying very calm. Then he took out the phone and played these cartoons on the phone. As soon as he gave him the phone, then the way he was giggling, you could say someone was tickling him. And you could say that maybe what he was watching was very funny. Okay. Now this is a child who is not that good in interaction and all that. But So the way he was laughing, I could tell this child is actually having gelastic seizures. He's having seizures, you know. I did not say anything to the parent. And then after some time, he took the phone because it was not finished. But he was still, even though he had taken the phone away. And that actually even confirmed that he was having these gelastic seizures. Now, those kind of seizures are triggered by any form of stimulation, you know. So, but then how will a parent know that this child is having seizures when he's giggling, you know? He's giggling. Like one particular one, I made reference to this one also in the in the 2 weeks back, where I had detected that the child was epileptic and told the parents, and they never realized that he was having seizures. But then I was saying he gets night seizures. But then she concurred that he never sleeps. Ever since he was a child, he never sleeps quiet. He's forever tossing and turning, you know, and doing all that. I said, when he's doing that, he's having seizures. But then, to cut the long story short, is that when I started with the treatment, I told that he's actually you're gonna see that he's having, because we're gonna trigger, poke the bear, which we did, and then the seizures, they came out, but then we managed to contain them. Then he was fine. And then I think a month down the line, then I was asking how is he doing and all that, and then she was referring to all the things that she was shocked that within such a space of time, this child has reached such milestones. Like now all that thing that he used to do, he sleeps throughout the night, the color on because he said he used to have yellow hands and yellow feet, but that has totally cleared. He was eating well and he was calm and all that. So she was giving me this report. Also the urination, because I said there were kidney issues. She said he used to pee like anything, the bed would be, but now he's peeing normally and all that. Then she says the only thing that I noticed recently is that he giggles when he's sleeping. He giggles like we will wake up and watch what is he laughing at. And then I said, he's having seizures. As the medication, then I found out that she had completed the batch of epileptic treatment that I had given. I said, no, I will be the one who tells you at what stage you must take it off, okay? Because he was also receiving medication from conventional for epilepsy now, because it like Epilam and Keppra. So I said he's having seizures. So we need to keep him on, because I had taken him off one of the strongest one from conventional. He was only on one, and then he was taking my protocols, but he had run out. I said that's why he's having seizures. So, and then I said, okay, and then but then she did not have money. Then I said, okay, if you don't have money to buy now yet, then you must take him back to this medication. The conventional. I gave her the dosage of how she must take him and what have you. And then after some time, then I asked her, she said, well, it has died down a bit, but he's still giggling. But at least now he giggles like, but when you call his name, he stops the giggling. But in the past, he would just giggle non-stop and giggle and giggle. So because those were seizures. So the reason why they're coming down is because the treatment, she's taking the treatment. So what I'm getting at is parents are not aware of different scenarios that children go through, because when a child is giggling, how will it would be mad for some people to think that it's because he's having seizures. Doesn't mean when he's giggling all the time he's having seizures. But autistic children I'm just giving this as an advice, that for autistic children, when your child, all of a sudden, you find she never used to giggle, especially if she's at night, you find she giggles at night. Some people say, oh, I thought it's tegoloshe, you know, and or whatever. Something, it's some tegoloshe, you know. So when the child giggles, you've got to know that there's seizures there. Okay. Or you must check, you must take him for assessment, because they should be able to pick up on the EEG that if there was a abnormality in the brain waves. Or if the child, out of the blue, maybe he was watching television and then all of a sudden he's not necessarily giggling, but is just acting strange. He looks excited, he's walking up and down, or maybe mimicking what he was watching and all that. You must know he's having seizures at that stage. Or if, for instance, you find that your child just becomes, it's like they just snap, they get very angry or afraid, and so those out of the blue kind of behaviors, you need to have the child assessed. Or if you can come to me, I'll be able to tell you if they are having those seizures. Because also remember, those seizures, any kind of stimulation, you may be driving past, or maybe the light may start flickering because it's starting to fade and it keeps on, then you find that becomes a trigger. There are so many things that trigger those type of seizures. So children that are autistic are very prone to those kind of seizures. So parents, I'm just giving this as an advice, because also remember, when a child is having seizures, it's not good for the brain, because the brain at that moment is actually deprived of free flow of oxygen. So so if it continues, the damage becomes bigger and and more extensive.
True. Yeah. Just to now get inside like autism, yeah? What do you personally, on the alternative side, have an impact on? Like, what do you do for people that have autism?
Yeah. Well, with me, firstly, like I said earlier, that the difference with me is that because what people normally do is they go to the psychologist or psychiatrist or whatever therapist, or in school, and then at school a therapist will do some psychological tests.
True.
And then they see you cannot read, you cannot talk, you cannot, so they tick the box, or maybe the parent will say this, and then they say you are autistic. With me, you come to me and I will scan you and I will be able to pick up that, oh, you are having a fibromuscular dysplasia. I'm mentioning this one in particular because recently I was just talking to the mother. Now that one is not is a different type, because it's a problem of blood vessels, of arteries. Okay, now what happens to those arteries? It makes them bulge. They lose their structure. It makes them bulge or even get constricted. And then when they're bulging out, sometimes they may rupture, which is very risky. And sometimes, and when they rupture, you bleed out. You will bleed. It's just like an aneurysm. Or they get constricted, twisted. And when they're twisted, there is no blood flow. You can have a stroke. Even as a child may have a stroke, and they don't know what is the cause for that. I mean, I had one who had a child who had stroke 3 times, before he was 10. She was 10. And it was not known what is causing that. So, but in her case, it was not this dysplasia. It was sickle cell syndrome, because also sickle cell, when it obstructs that flow, then you'll find you will have, you might have a stroke depending on where the obstruction is occurring. So with me, therefore, I will be able to say, to tell you, Uguti, what is actually happening in this particular child. Like this fibromuscular dysplasia that I'm talking about. This parent, a child is labeled autistic, okay? But in this particular child, the obstruction, because autism, the problem with autism is that once it obstructs the flow of the blood to the brain, whatever's causing the obstruction. And remember, these are the lobes, temporal lobes. Temporal lobes, that is where language is controlled. That's where emotions are controlled. That's where sounds, as you see where the ear is sitting, that's where it's controlled. That's where memory is controlled. So all these functions that you find tend to have issues with children that are autistic. This is where they are controlled. So therefore, that is why you find they will even have epilepsy, temporal lobe epilepsy. That is why you find their anger outbursts. They cannot sit still because even alpha waves. You know, I was just talking to one parent and offering that, you know, I'm in the process of developing a video a therapy where the child will actually receive some kind of music and input, but then I'll be able to know who qualifies, because if you've got an obstruction, even if the obstruction that blocks the input of sound, even if I were to give you that, it's not going to work. So, but I'm in a position to see that, no, in your case, the blockade, there's no blockage in input, okay? It's just in the output, maybe that's the problem. And so I offered to this particular parent, because her child has started talking, but he's just mimicking the parent. There is still no coordination between the word and the meaning of the word, so that he's talking something that's sensible.
There's much more improvement than before.
He could not do that.
Exactly.
He could not do that. But now he can hear what the mother's saying, and he can mimic. Okay. She could still give him instructions in the past, here and there. But now, but there was no output from his side. But now, when the mother says hamba, he says hamba. But he does not understand what hamba means. Okay, so when so some words he's starting to put one and one together. Like, for instance, she said he threw the box, then a container that was empty, said finished. So meaning he understands that particular. So certain words he understands. So now, so there is already a connection there. But now you need someone who's going to take it forward further and coordinate the process so that there are no gaps. Okay, so that clip, this therapy video that I was saying I'm going to offer is going to help with that, but also help with the alpha waves, because remember, the alpha waves are the ones that make children to become. Okay, they're sitting on the temporal lobes, so where the issues are occurring. Because children with autistic issues, this is where the main issues are occurring, and therefore affecting a whole lot of other things. So, and this is where the alpha waves are also sitting. So this is where you find, once you maximize, the alpha waves, they help that child to relax, no longer irritable and wanting to punch everyone in the face. So that video is going to be a combination of working on the alpha waves and also coordinating the functions of the temporal lobe, so that when he says hamba, he knows it means walk, or go away or something like that. So that's what, but that's that's on the treatment part. But on the diagnostic section, I will be able to say, this is what is happening, and this is affecting the vocal cords, or he's having epilepsy, even if you're not aware, or that. So that's the start. So with me, I don't listen to your symptoms. I tell you what you should be experiencing, and then you can relate to that. Okay. Because I can connect to say, okay, in your case, you're having epilepsy because this is what is happening. So even if you did not know it's epilepsy, but now you know, it's epilepsy. And then when I give you treatment for epilepsy, then you find no longer tossing and turning at night is sleeping, because now we've treated that epilepsy. So that brain is no longer causing those issues. So that's what I do. The difference with me is I will diagnose, and then the treatment will be mapped out according to what I have picked up, which is the difference from a conventional. And I would have loved, when I look all, I would have loved for us to work together with some of these therapists. Because, for instance, the speech therapist is only dealing with working on improving the speech. But to see where is the blockage and why is there a blockage? Why is this child battling, because like, for instance, this particular child would be perfect for a speech therapist now, because there is now coordination between input and output. He just needs to remove the gaps. Okay, so those, if we were to not work each one in their corner and each one in their corner, it would make a huge impact in making life so much and bringing better progress for these children, and making life so much bearable for the parents.
Most definitely, man. But I just want to touch on now the advantages and disadvantages of autism, and also the challenges that you sometimes face when people come to you that have autism.
Well, I don't know if there are advantages of autism. Because seriously, I mean, even though I'm just thinking this movie. I don't know if it was based on it's on a true story. This particular child who could read, who could crack codes, irrespective. I mean, he could crack codes, even codes of military codes. But for him, because of his how his mind, processes information, he could crack it. That's not a far-fetched thing to be real, actually, because they are musicians. There are people who are. In fact, there's I can't remember, one of these big actors. Her husband is actually autistic, but they're big. There are lots of celebrities, people who have made it, who are autistic, who you find are gifted in a certain area, so they will just channel that area. Because if you're a musician and you come with the most amazing compositions, where people wonder, how did you think of this? How did you come up with this kind of composition? But because that's how your brain is wired, then you find in your case you manage to realize such milestones. So I would say it's an advantage then in that case. But on the overall, because you get very small percentages of people that are actually gifted, but most of people that are autistic, you find they're just no way. They cannot talk, they cannot, and also the way the programs are structured for them make life really impossible for them to make anything better of themselves. Because look at the drugs that they are put on, and you find, can you really blame that parent? Because if your child, as soon as he gets up in the morning, up until he goes to sleep, you never rest. He's taking the glasses, jumping on the fetching what is living tap. You go mad.
But don't you think that's also a problem of giving them the drug because they're going to get used to it.
Of course, it's not.
What happens when there's no drug anymore?
No, let alone when there's no drug anymore. Even the drug itself, the side effects of those drugs are horrendous. They give them knowing that the side effects, you must know, you put this child on this, that's it. Like you say, he's a drug addict because he cannot function without this. But then the parent says, but what else can I do? Because I must go to work even for this child. Who's going to look after this child because he never sits still. You know, whereas these Ritalins, they make them, you know. So then a parent is a case of choosing, do you live with this and go to work and come and be able to provide means of livelihood for your family? Or do you let him destroy everything and no one can stay here or whatever because he's hitting, he's biting people, he's punching, he's just, you know. But you know, that child, when that child is doing all that, do you think he's actually happy? He doesn't know how to communicate, to say, hey, I'm suffering. He's suffering. This is his way of trying to cope with all this. He's suffering. I promise you, he's suffering, you know. But in the absence of something different or something better, then you find the parents are, you know. But also, to a great extent, people who I blame even more than parents are therapists, because they are the ones who you find, even when a parent says, no, I don't want to go that route for my child, then they say, no, then you cannot admit, we cannot admit him in this group because it's disrupting everything. So you find some parents don't want to subject their children to all these drugs, but they don't have the alternative because they want the child to be at school, at least under some supervision, under some program. But the requirements of the program are either the drug so that he can listen or he can sit still, or find him another school. So it's a big problem, which is why I am saying with our program, because remember with me, I take them off the drug. I mean, they come taking these Ritalins and these Concertas and the whatnot. I take them off that. So I take him off because I'm going to be able to tame this child and make him calm in a natural way and in a way that is not destructive. And that's what we are doing. You know, that's what we are doing.
And it's working.
And it's working. And it is really working. So, and also not only making them calm and all that, because like even with these seizures, they sleep well, they eat well. Parents are shocked that their children can actually eat this well, eat everything, including the veggies. Because even with the veggies, we will tell you which vegetables are appropriate for your child. Doesn't mean all vegetables, but we'll tell you today, give him this, then you find he actually eats it. But you find at the beginning, they are really difficult because they're not used to it. But once you get them to do it, then you find, they actually, then they find they feel good, and then you find they ask for it themselves. So it's working in terms of calming them, in terms of stimulating the brain. Like one parent was even saying, she said it in Xhosa, you know. Otherwise he was nowhere. So it's working, but it's a program which needs a collective effort. Okay, because if I were to work in cooperation with these programs that they have, I promise you, the transformation will shock people. Because even when it comes to costs, because remember with me, there's no medical aid coverage. So I can do all these things for their children single-handedly, but the money, because even though they've got medical aids, they cannot, I'm not covered by the medical aid. So, which digs deep into their disposable income, and that's a problem. So if we were to have a cooperated and a collaborated program with them and have the medical aid covering it. I promise you, Luxolo, I promise you, this is not a pipe dream that I'm talking about. We would shock people. We would really shock people. Because of time, I think this is where we're going to end our talk today. Thank you for watching, and I hope this is helping to clarify. Bring your children so that I can tell you what is happening to them. And then you at least know how to craft the way forward instead of just shooting in the dark, not knowing. But anyway, thank you for watching, and goodbye.
Most definitely, yes, man. What a lovely and mindful topic that we have just broken down. And I definitely feel like every teacher, parent out there could really bring out their children for help who have autism, because we can really help this country and also help this disorder that we really have. Until now, it's thank you.